Hello, my name is Cameron Clark, and this multimodal document is focused on college athletes. No field, no court, just mental health. What exactly is a college athlete? Many might know that a college athlete is a student who participates in organized sports as a representation of their college or universities. These are many sports, including basketball, soccer, track, field, swimming, and this often depends on the sports programs offered by the institution. These sports are also combined with the academic program while competing with the intercollegiate sports. A look into Miami University sports is that Miami University's football team is heading to their bowl game after just defeating Toledo in the MAC championship. Go Redhawks. Let's talk mental health. Mental health is not just the presence of mental disorders. This is an array of conditions, struggling to how to handle stress, relate things to others, make decisions, and also function on a daily. These mental health aspects affects thoughts, feelings, and behaviors. As far as this multimodal target audience, we will be focusing on college athletes across the board. The individuals in this group of college athletes can experience difficulties, challenges, and stressors. While not all college athletes have to struggle with their mental health, this is a very well-known circumstance. Many potential inhibitors of poor mental health could be academic pressure, performance expectation, and financial struggles. These will be only 3 categories that we focus on within this presentation. Academic pressure. The ability to balance the demands of academic and athletics can become a difficult thing. With a rigorous training schedule and collegiate workload, the ability to lose focus in both aspects is present. This is a very well-known issue within the mental health aspect. From PubMed Central, it is said that no significant differences are found for the sex, academic status, and sport type for depression or self-esteem. However, significant differences occurred for the state of anxiety within sex. When looking at a presented document of a graph that withholds information within the PubMed Central article, this is a presentation of the state and trait anxiety intervention. The college students' norms were used for analysts using a baseline in order to implement the data. State anxiety means the standard deviation for females were 38.76. And for males, it was 46.47. Within this chart, you were able to see the differences between sex in relation to depressive symptoms, state of anxiety, trait and anxiety, and low self-esteem. Performance expectations. The expectations placed onto this population through family members, peers, coaches, teammates, as well as oneself can turn into a stressor, leading to anxiety. Many athletes have reported that they suffer from performance stress because of the demands of their sports. In addition to practice, many athletes participate in weightlifting, nutrition classes, psychology sessions, and etc. When an athlete is injured, they have a tendency to experience more stress than healthy athletes. This is brought to us by Brigham Young University Scholar Archive. This quote is just to inhibit the idea of performance stress onto the body, mind, and soul when speaking on college athletes. This is a graph that is in relation to the percentage of participants who endorse or agreed or strongly agreed statement on various accounts. Brought to us by the NCAA. One statement was, "I know where to go if I have a mental health concern." 63% of men said yes, while 69% of women said no. These are participants within the sports realm as well. Another statement was, "My teammates take mental health concerns of fellow teammates seriously." Only 58% of men stated they agree, while 65% of women said that they agree. On to the next category of inhibitors could be financial struggles. In some cases, college athletes may be in a situation where they are not receiving the proper financial support. Many struggle with this continuously while others make adjustments and gain a second job. This statement, on top of the fact that collegiate sports is already a job, can hinder an additional academic, athletic, and time management stress. A quote from R.J. Corrington from the importance of NCAA student athletes, financial literacy and mental health and anticipation and historical fair play to pay states that the hard work to become a professional and the pressure to win competitions for the university with certain desperate collegiate regulations can take a toll on the student athlete's mental health. Further, the focus on becoming a professional athlete takes time away from learning the tools needed to survive in an economically driven society. This is already a hindering factor within society, and the placement of collegiate sports can add to the poor mental health. Schools can't pay their players, though some coaches have proposed that college athletes be treated as salaries employees. This is the statement to ensure one on the lack of financial stability. Also, the promise of deals can't be used to recruit high schoolers or to ensure transfer students into coming upon the collegiate team. This is a rule that is broken by one school or another pretty much every day. Sometimes the drive for payment is enough. The call for help. Daniel Enzenberg, an associate professor at the University of Michigan School for Public Health, found that 33% of college students experience significant symptoms of depression, anxiety, or other mental health conditions. Among that group, 33% seek help, but of college athletes with mental health conditions, only 10% choose to seek help. The difference between percentage is very heartbreaking. This table is here to show what COVID-19 did to affect the return of college athletes after the abrupt spring semester of 2020. The three main themes emerged from the responses were worsening of mental health, anxiety related to the pandemic, and positive experience after returning to campus. Interventions. Multidisciplinary treatment teams are able to provide a holistic approach that ensures student athletes are able to optimize their personal, social, academic, and athletic goals. Some intervention examples are counseling services, sports psychology services, educational programs, and many of these lists goes on. This is just a rough draft of what could be done. As far as what happens right in front of us, Miami University interventions. Sports psychology services offer confidential mental health counseling to Miami University students. This is an attempt for a prevention, intervention, and other services that are provided to help student athletes in mental wellness, in both in and out of sports. The mission statement done by Miami University Sports Psychology is to help student athletes develop and maintain healthy personal, emotional, and psychological functioning so they can achieve their athletic and academic goals. Furthermore, some services are group support, team interventions, and mental health skill training, referral services, couples counseling if both individuals are eligible. The list goes on. Miami University does have a lot of services that are implemented within the university in attempt to reduce the stigma towards mental health. Some frequent concerns could be relationship concerns, personal concerns, developmental concerns, cultural concerns, academic concerns, and the list goes on, as well as substance use, food preparation, or preoccupation, and health lifestyle choices. I've also decided to include how to make an appointment, whether this is an athlete watching this video, whether this is someone who knows an athlete that could be in in need of this type of services. So this would start from the conversation from your athletic trainer and or a call to the Student Counseling Center, which the number is provided, as well as the Hope Line that is crisis intervention for yourself and another student that might be in need. Insider look. Interviewer, I've decided to implement interviews straight from collegiate, former, past, or present athletes. This interview was conducted by myself in regards to James Burns, a former Miami University football player. I've decided to ask him and 2 other players the same 4 questions. One being, if you had one word to describe your mental health as a college athlete, what would you say? Humbling was the response. Do you feel like many of your teammates struggle with mental health? He responded with absolutely. 3, do you feel as though mental health is a topic commonly spoken about in your athletic world? He responded, no. Coaches don't really care. Nobody does for real. It's just all about football. No one takes time to make sure you are okay as long as the numbers are there. This was then capped by the question, does one know about mental health resources on your campus? This was responded with yes. They tell us about it, similar to a general meeting, but that's about it. This then could have been looked on in comparison to Amaya, a current Miami University volleyball player. When asked about one word to describe your mental health as a college athlete, she responded resilient. Then followed up by, do you feel like many of your teammates struggle with mental health? She replied, definitely. Third, it was asked, do you feel as though mental health is a topic commonly spoken about in your athletic world? She replied, yes, but no one really tries to talk about it. It's very subtle. Fourth, are you familiar with mental health resources on your campus? She replied, yes, they have sports performance psychologists that are available. After looking at a past male response, a current female response, I finished up with a current male response at Miami University as Jaquel Morris. When asked if you had one word to describe your mental health as a college athlete, what would you say? He replied, good. Do you feel like many of your teammates struggle with mental health? This was then solidified with a of course. Third, it was asked, do you feel as though mental health is a topic commonly spoken about in your athletic world? He responded, no, I'm not sure why not, but I'm pretty sure people don't want to seem soft. I understand that. When it was followed by, are you familiar with mental health resources on your campus? He then said, yes, I'm not sure. Yes, but I'm not sure they're being used. With that being said, in an insider look, I've decided to reiterate that breaking the cycle of poor mental health in college athletes involves implementing a multi-faced and proactive approach. Using key strategies such as raising awareness, offering services, reducing the incorrect stigma, and creating a support team are many things that can be done to reach that goal. May is the month of mental health. May is Mental Health Awareness Month. If one is in need of mental health services and or you know someone that needs them, please redirect them to located resources on their campus as well as Miami's campus, as it is a very prestigious intervention.